Are you worried about how Medicare changes in 2025 will impact your prescription drug costs? With the new Inflation Reduction Act rules, you could reach your $2,000 out-of-pocket max faster than you think. Even if your actual copays are low, stick around because today I'm breaking down everything you need to know about these changes so you can make the best decision for your healthcare in 2025. Hey guys, it's Kelby with the Medicare Hub. We are here to make your life easy by making Medicare simple. So today I'm going to dive into how the Inflation Reduction Act changes in 2025, and the changes will impact Medicare drug plans, especially for those of you with tiered formularies. This might sound complex, but don't worry, I'm here to really guide you through step by step. You'll learn why your out-of-pocket costs might add up faster than expected and what you can do to manage them effectively. If you find this information helpful, don't forget to like, subscribe, and share with anyone else who might benefit. Let's jump in. So most Medicare prescription drug plans use a 5-tier formulary system to determine the cost of each drug. Here's how that works. So Tier 1 and Tier 2 cover generic drugs, which are usually the most affordable. These tiers have the lowest copay and can save you a ton of money on medication costs. Tier 3 is where you'll find most brand name drugs. This tier generally has higher copays than the generic tier, but is still often affordable compared to the higher tiers. Tier 4 is non-preferred drugs. If your medication is in this tier, it is likely has a higher copay cost because it's not the plan's top choice in that category. And then Tier 5 is reserved for specialty drugs. These are often for more complex or chronic conditions and can be very expensive with the highest copay cost overall. So under these tiers, many of you are used to paying a set copay amount for your medication. So if you have a Tier 3 brand name drug, you might be used to paying something like $45 each time you fill your medication or prescription. Here's where the Inflation Reduction Act changes things though in 2025. Under the new rules, Medicare has introduced an annual out-of-pocket max of $2,000 for prescription drugs, which is a fantastic cap for anyone with high drug costs. But the way this cap is calculated might surprise you. Rather than just counting your copay amount, Medicare standard cost-sharing formula calculates 25% of your drug's retail price to go towards that $2,000 limit. Let me give you an example to really clarify. So let's say you have a Tier 3 drug that normally costs $400 at retail. Under the new rule, you're responsible for paying 25% of that cost, which is $100. However, if your plan's Tier 3 copay is only $45, you might be paying less than that 25%. So even though you're actually paying $45 out of pocket, the entire $100 based on the 25% is going towards your $2,000 annual limit. So the retail price counts towards that $2,000 limit and not the $45. This means you could reach your out-of-pocket maximum sooner than expected, even though you're paying a lower copay. In other words, this 25% formula accelerates the total out-of-pocket amount that counts toward your limit. By the end of the year, even if you're paying low copay, you may still max out at $2,000 because of the higher retail calculations and how that works. So how does this affect when you're choosing a plan? Each Medicare Advantage prescription drug plan, or an MAPD plan, and standalone prescription drug plan, a PDP, can have slightly different prices for the same medication. This is because insurance companies negotiate their own contracts with pharmaceutical companies, meaning the retail cost they use to calculate your 25% can vary plan to plan. For example, one plan might have a retail cost of $400 for a drug, while another lists it at $450. Even though this doesn't change your copay directly, it does impact how quickly you reach that $2,000 max out-of-pocket limit. In a plan with higher retail pricing, your 25% share could get you to the limit faster. To make sure you're not paying more than you need to, compare how different plans price the drugs you take most often. This isn't just about finding the lowest copay, it's about understanding the full retail cost listed in each plan and knowing how that affects your out-of-pocket spending across the year. So what's the best way to navigate these changes? It's all about reviewing your drug plan options carefully during the annual enrollment period each fall. Take a look at how your medications are priced under each plan. Some plans might list a higher retail cost for your medications, which could speed up how quickly you hit that $2,000 maximum. Another great resource is calling an agency, comparing different plans, and you can also work with a Medicare expert like us to break down these costs and help you see which plan offers the best value. By understanding the cost share structure and retail pricing, you'll have a much clearer picture of how each plan will affect your out-of-pocket expenses over the year. So in summary, the Inflation Reduction Act changes in 2025, which means that even if your copay is low, the 25% retail cost calculation could still push you towards a $2,000 max out-of-pocket limit faster than before. This makes it more important than ever to compare plan costs and know how your retail prices factor into your annual spending. If this sounds complicated, don't worry, we're here to help. Navigating Medicare is what we do best. We'd love to guide you through these changes to make sure you're in the best plan. You can click below or call our office and schedule a time today. We'd love to talk. Hey guys, thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon to stay up to date with the latest Medicare changes. If you're ready to get personalized help with your Medicare plan, click the link below to schedule a free consultation with us today. Together we'll make sure you're set for 2025 and beyond. Share this video with somebody you may know that needs it, and we'll see you in the next one.